will be asked later today to approve the biggest personal tax rise in decades to fund social care and help get the NHS back on its feet.
Health Secretary Sajid Javid joins us now. Very good morning to you.
Good morning.
Do we no longer believe anything that the Conservatives promised in their election manifesto?
I think hopefully what people believe after hearing about this package is that the government is absolutely committed to the NHS. We will support it in every way that we can, especially in light of the global pandemic. And also, we're meeting our commitments in adult social care and giving people, older people, much more dignity as they reach old age.
The trouble is that commitments don't mean much if it's a general election you got elected with a thumping majority on a commitment that you're not sticking to.
Yeah, I'm pleased you brought that up, because I want to tackle that head on. It is absolutely right if you're suggesting that we've broken a promise in our manifesto, which was not to raise certain tax rates. But I think, and I hope, actually, when people are digesting this package, what the government has said yesterday, they will realise that this is the act of a responsible government. So I can tell you, for example, with the NHS, as the incoming Health Secretary, when I learnt that if we carried on with business as usual and waiting lists could go up to 13 million because of the pandemic, no Health Secretary could stand back and tolerate that. And so if you're suggesting that actually it would have still been better to stick to the manifesto pledge and deny people the health care that they so dearly need, and that somehow is a better outcome from a government, I think you'd be totally wrong. What's the right thing to do is the responsible thing, which is to say to people, we did not expect a global pandemic and we are responding to the challenges, helping the NHS plan for the long term, and we're meeting our commitments on adult social care to make sure that people do not face this catastrophic risk of these catastrophic costs in social care.
Will that be the end of the broken promises on the manifesto? There's an interesting cartoon in the Mail this morning from Pew, and it's a lady and her husband watching television, and it says, this one will be a challenge. Someone's just bought in a broken manifesto. They're watching the repair shop on TV. Is that the end of those manifesto pledges that are going to be broken? And can you guarantee that, do you know what, we had to do something here, but there will be no more tax rises?
What I can guarantee is that we will continue to be responsible and a serious government that will confront the challenges that the country faces.
And I think of what you've promised us in the past.
I think your viewers will understand that this pandemic, the global pandemic, no one expected it. I don't think a soul in the world thought anything like this was going to happen. And we've seen the huge damage it's done across the world. Sadly, the deaths that it's led to, but also the challenges we still have because the pandemic's still going on. Yes, the vaccines have given us a wall of defence. Things are better than they were before. But we need to deal with the problems it's created and make sure we continue to deal with the risk of the pandemic, and that should absolutely be a huge priority of the government. And if that means, that some of the promises we'd set out in the past, some of the commitments that we made have to change, I think people understand that. I think what people want is a government that's going to be frank and straight with them about the challenges we face and confront those challenges.
Anyone with assets over £100,000 will, under this new plan, pay for all of their care. It's going to be capped at £86,000. But if you've got a house of that value, just over £100,000, how are you going to afford the care without selling your house?
Well, what this package does is that, as you have alluded to, there's two main parts to it when it comes to adult social care. One is this cap on lifetime cost, that no matter how, what your age is, where you live, you will never face more than £86,000 in total of social care costs. And that gives people the confidence to plan for their future, to plan their wealth, to sit down with the family in a way that they could not do before. But also the means test is also a lot more generous than before. Anyone with assets below £20,000 will get 100% of their care costs paid by their local authority. Between £20,000 and £100,000, they will get some of those care costs you paid by the local authority.
Yeah, but, sorry, my point was, if your asset is your house, it's over £100,000, just over £100,000, then you're liable to pay for your care. And I'm just wondering, because it's another promise in the Tory manifesto in 2019, one condition we do make is that nobody needing care should be forced to sell their home to pay for it. You're not going to be able to stick to that, are you?
The £86,000 certainly helps provide the confidence you need to plan for the future, but also we will make sure that anyone who needs it, and there will be far fewer people than in the past, but anyone who needs it, that there's something called the deferred payment agreement, which means no one will have to sell their house during their lifetime. During their lifetime.
That's the condition.
That's right. No one will sell their house. No one will ever have to sell their house during their lifetime. And taken together with the £86,000 cap, which gives that confidence, they can plan for the future in a way that they can't in the past. But what this package means
so
overall,
the deferral means the house may still need to be sold.
Taken together as a package, what it means is that you have the confidence that your cost will never exceed £86,000, which clearly wasn't there before. If I can point out that we estimate that 1 in 7 people before were facing catastrophic costs of care over £100,000. There's a real sort of lottery to this, depending on whether you had dementia or cancer or something. You had different ways those costs were met. That's not right. It's not fair. And it's right that we cap those costs and allow people to plan for the future.
So we know that for the first 3 years, a lot of this money is going to be used to try and clear that backlog, as you've pointed out, the huge backlog that we have in the NHS caused by COVID. After those initial 3 years, can you explain how much money is going to go on social care? I know you couldn't answer this yesterday in the press conference, but I wonder if you've been given more clarity on that so we can understand that this tax rise that we're all paying for our social care, how much of it is going to go towards social care?
Yeah, let me explain that. In the first 3 years, the majority of these new funds that are being raised will go into the NHS and helping it, as you say, with that backlog. And I think most people can see why that would be the case. Despite that, though, there will still be a huge amount of extra money going into adult social care during those 3 years as well. That's estimated around £5.4 billion, paying for things like workforce training, as well as this cap and the means testing, and also more money to local authorities on top of the 20 billion a year that they currently get. After the 3 years, we would expect that the proportion that's going to adult social care will start rising, and that's going to happen partly because of the way the new adult social care settlement is structured, because that cap of 86,000, although it will be introduced during the 3 years, it means that it will start, let's say, it will start sort of biting and costing the state, because it will start meeting the cost above 86,000 only after a few years. So that
Health Secretary, I'm sorry, you're still being very vague. You're saying it's going to start rising, but you still aren't going to say, look, 80% of that is going to go to social care, 100%. Can you give us a more defined figure? Because you want to clear the backlog in the NHS, which is huge, but the NHS bosses are saying it's going to take 10 years for that to be cleared.
Well, I think it would be irresponsible for me to say exactly in 3 years' time how the split in funding between health and social care is going to be done. What is, I think, probably more important, that this new levy, this new way of raising this financial support is for both health and social care, and it should be, after 3 years, used in the most appropriate way, but making sure that it meets the commitments that we're making today.
What do you say to those families, and campaign groups say that it is over 2 million, who are about to lose their universal credit allowance, the uplift of £1,000 a year, and are also going to be paying an extra £100 a year in national insurance? That's a double whammy for those at the lowest end of the wage system, isn't it?
Look, I understand that, and I think it was clear that when the uplift rightly was introduced in universal credit, that it was not something that was really sort of possible and sustainable to keep forever. It was to deal with the immediate challenge that we face, especially through the economy and through the job market. What's changed now is, if we look back even 18 months ago, where at the start of this pandemic, what's very different now is our economy is growing again. It's growing strongly. It's actually growing faster than was projected by the OBR. We've got a record number of vacancies for jobs, and earnings are starting to rise at record rates. And that means that there's more and more opportunities out there in the job market, and that's good to see. But that wasn't the case when the universal credit was introduced. I'm not talking about the people who are looking for jobs. I'm talking about the people who are already working, who are going to be using. So saying that there's jobs for them, they're already working, and you're about to give them a national insurance rise. And I know, of course, that you're talking about people that are already in jobs, but the strength of the job market is important to anyone that, whether you're in a job or not. We all want to see a strong job market because it will
Your message
help
to
all of
those
us.
people who face a national insurance rise and the loss of universal credit uplift is go and get yourselves a better paid job.
No, that's your words, not mine. I think I've explained why the universal credit uplift has to end. It was temporary, and I've set out the reasons why that happened. But when it comes to the tax change, this levy, this 1.25%, it's right that it's done in a way that is very progressive. So those that are on higher incomes, of course, will contribute a lot more. In fact, with this new levy, the 14% of highest earners in the country will pay around 50% of this levy. If it's someone on a basic rate of tax, which is probably applies to the examples that you've given, that's around, I think for them, it's around £180 extra a year. For someone who's paying the higher rate of tax, it's around £700 extra a year. So it's right, when you raise tax to fund our NHS, to fund adult social care, that it's done in the most progressive way possible.
All right.
All right.
Javid, we have to leave it there. Thank you.
Sadly, we're out of
very
time,
much.
but thank you for joining us this morning.